Dear friends and colleagues, welcome to the new edition of our webinar series of the Forum for Global Health Ethics. Our topic today is offering financial incentives to participants in health and breastfeeding research. This event is organized by the Institute of Biomedical Ethics and History of Medicine of the University of Zurich, the Swiss Medical Weekly, the Global Health Network, the University of Oxford, and LactaHub, an evidence-based resource for breastfeeding intelligence. Next slide, please. My name is Nicola Bellandorna, and I'm the director of the Institute of Biomedical Ethics and History of Medicine at the University of Zurich, WHO Collaborating Center. I would also like to introduce the co-chair of this event, Tanya Manriquez, coordinates the Forum for Global Health Ethics, an outreach project hosted at our institute. Tanya and I will be moderating this event together. We are privileged to have with us today, and we'll see this in the next slide, Mary Annie Ampansa, Farah Asif, David Resnick, and David Yanagisava-Drott. We will introduce you at the time when we invite you to present your main ideas. We thank you for accepting our invitation to this webinar and are looking forward to your presentations and further discussion in a while. The organizers of this webinar have an interest in opening a discussion on the use of financial incentives for research participants. We know that offering financial incentives is a common practice in health research and that its use remains controversial in some cases. Today, we will discuss ethical questions around financial incentives, and we will address the example of breastfeeding research. Tanya, I hand over to you.
Thank you, Nicola. Thanks very much to our audience for joining us today. I'm delighted to have been asked to co-host this session. So I will give you some information and then I will introduce the agenda of our webinar. So if you're joining us on Zoom, we invite you to send your questions to our speakers anytime during the Q&A function, using the Q&A function that you can find at the bottom bar of your screen. If you're joining through the Global Health Network Facebook page, please send your questions via Facebook Messenger. We will answer as many questions as possible during the Q&A section. If you can't hear or see us, please check your computer preferences, close other programs, check your sound level, restart the Zoom meeting, or join via Facebook. You can use the chat box below to introduce yourselves, to tell us from where you're joining. You can also send us your email if you would like to get information about the next webinars that we will organize with the Forum for Global Health Ethics. This event is being recorded and will be shared with a wider audience at the Institute of Biomedical Ethics website and also on LactaHub. Cameras and computers have been deactivated. Now our agenda. So first, Nicola will give a brief introduction of EFBRI, the Evolving Ethical Framework Informing Breastfeeding Research and Interventions. Second, and to start an exchange with you, we will use the poll feature on Zoom to ask you 2 short questions on the topic of financial incentives in health research. Then we've got 4 fantastic speakers today, and they are going to present their views on financial incentives. Afterwards, we'll open a 35-minute Q&A section, and we will end this webinar with a second round of the poll, and we will find out if your views changed after the presentations and the discussion. The event will last 90 minutes in total. Nicola, I'll hand over to you now.
Thanks, Tanya. I'd like to briefly introduce EFBRI, an evolving ethical framework informing breastfeeding research and interventions. This webinar today is a complement of the LactaWebinar on EFBRI that we hosted in March this year. And so a little background on what EFBRI actually is. It's an open access compilation of ethical principles to guide research and breastfeeding and lactation, and the framework lays the groundwork for best practice ethics and healthcare policy implementation and funding activities. It's really a synthesis of Swiss and international laws and guidelines, and it bridges practice and research. We acknowledge the importance of the context in which research takes place. Some issues may be judged differently depending on cultural, social, and economic factors. And it's important to realize this is really an evolving framework as ethics gradually change globally, and EFBRI is applied to new and different situations the framework will require reviews and updates to involve in parallel. So EFBRI is really a learning document in the tradition of community science. Explicit feedback from the research community and suggestions will really help us to build a comprehensive resource. And it's important to know this is interactive, the framework. It's easy to find, simple to use, and globally applicable. So if you'd like, have a look at it, provide feedback, and help us improve this resource. Next slide, please. So when building this, what we found is that financial incentives is a prime example of where EFBRI needs create space for interpretation. What we have right now regarding financial incentives in this framework as one example of a research ethics framework governing a specific area of research. We have the following stipulations, and that says no person can receive a payment or any other pecuniary benefit for taking part in a research project that has an expected direct benefit. Participation in a research project with no expected direct benefit may be appropriately remunerated. We also say that research protocols must include information on incentives for participants and provisions for treating and/or compensating those who are harmed. And finally, the human body and body parts may not be disposed of or acquired for research purposes in return for payment or other non-cash advantages. Those of you who are from Switzerland will see that this is very close to the Swiss law governing research involving human subjects. And that's for the reason that the foundation who invited us to create this framework and who was very keen on making sure that the research that it sponsored, that's the family Larsen Rosenquist Foundation, that this research really complied with national and international rules, really wanted and invited us to be as close to the Swiss context as possible to make sure we really comply with national regulations. But if you look at those stipulations, you will see this certainly doesn't answer all questions. For instance, what is the appropriate role of incentives in the case of research with no expected direct benefit? Or what about research that's more on the implementation side of things? That's not so much biomedical research, but really deals with public health and behavioral issues. Next slide, please. So let's take the Swiss context now as an example for those open questions. In Switzerland, and we are lucky to have one of the lead authors of the key guidance that's available on this with us today, Dr. Peter Kleist. This position paper really says that Swiss ethics committees are free to make case-by-case decisions as to whether a financial contribution and its amount are appropriate or not. There's a critical assessment of financial contributions with a pure incentive character that's uncoupled from effort and burden. And there's also some discussion around the fact that the more likely direct benefit for the individual is, and the higher the risk is, the more problematic incentives actually are. And finally, offering financial contributions to participants from vulnerable groups is only conceivable in exceptional cases. So here we have an example where the broad framework is really complemented by some national rules, and still we have, of course, this opens up further questions such as how can we establish adequate financial incentives in health research that takes place in different contexts? If this frame is right for Switzerland, other contexts may think differently about this, and how to offer adequate incentives to influence health-related behaviors and outcomes specifically. So this kind of research that's been termed implementation research, and that is typically not in the center stage of a lot of the research ethics guidance that we know. Next slide, please. So just by the way of a little background, some of you may have noticed we've written a viewpoint that's been published in the Swiss Medical Weekly on this issue, and we highlight the Declaration of Helsinki and the SIOMS guidelines as, of course, our core references in addition to the relevant GCP rules in this area. And we highlight, what we perceive as the main ethical concerns as reflected in the literature. That's undue inducement, exploitation, biased enrollment, and bribery. And we'll come back to this in a little polling exercise in a moment. And of course, there are also potential advantages to using incentives that's removing any kind of financial barrier to participation that may exist, obtaining diverse samples, and fostering behavioral change. And with that, I'd like to hand over again to Tanya for the poll.
Thanks, Nicola. Now let's go to the poll. So we will ask you 2 questions on financial incentives for participants in health research. Please answer them so that we get an idea of what you think about the topic before we listen to our speakers. Participation is anonymous, and speakers and hosts will not be allowed to vote. You will have some seconds to answer the questions, and then we will share the results with everyone. So please vote. So the first question: is it permissible to offer financial incentives, for example, payments, vouchers, gifts to participants in health research? You can say yes, no, or I don't know. Now we can move on to the second question. The second question is, in your opinion, what is or are the main ethical concerns regarding the use of financial incentives in health research? Here you can select multiple answers. So you can say undue inducement. People can be encouraged to make a financially motivated decision against their better judgment. Or exploitation. People may be offered inadequate compensation considering their contribution in terms of time, effort, inconvenience, and opportunity costs. Another option is biased enrollment. So people from vulnerable groups may participate in research at a higher rate. All right, so 67% of the people who voted think it is permissible to offer financial incentives to participants in health research. Well, 23% of the people who voted think it is not permissible to offer financial incentives to participants in health research. And 10% of the people who voted don't know whether it is permissible or not to offer financial incentives. Now, according to the people in our audience who participated in the poll, the main ethical concerns regarding the use of financial incentives in health research are in this order. So first, undue inducement with 71%. Second, biased enrollment with 67%. Third, exploitation with 52%. And last, bribery with 43%. Okay, this is very interesting. I'm curious whether after the presentations, cohort speakers, and the discussion, we will change our minds about all these issues. Thank you for participating, and I will hand over to Nicola now.
Yeah, really interesting indeed. I'm curious what the results are going to be at the end of the session. So the first speaker today is Mary Annie Amponsa. Dr. Annie Amponsa is a researcher and lecturer at the School of Nursing and Midwifery, College of Health Sciences, University of Ghana. She holds a PhD in nursing from the University of Alberta, Canada, and a newborn care specialist certification from the USA. She has 18 years of neonatal healthcare and education experiences and is currently the country representative for the Council of International Neonatal Nurses and the faculty chair of neonatal intensive care nursing at the Ghana College of Nurses and Midwives. Her research focuses on neonatal survival strategies in rural, remote, and resource-limited communities in Ghana, and she uses family, care provider, and multi-stakeholder engagement approaches. Mary, I give the floor to you.
Thank you very much, Nicolina, for the great background you've given us, and thank you for the introduction as well. So for the next 5 to 7 minutes, we're going to look into global evidence surrounding financial incentives in research, and then we're going to hone down into financial incentives impacting breastfeeding research. We'll look at ethical issues. Some of them have been mentioned already, but we'll still have a quick look into them. And then we would look into what the future might look like if we continue on the pathway that we are on at the moment. Next slide, please. So what is the state of the evidence as we speak on financial incentives in health research? What we do know is that there's so much unmet social need. and that will require support and sustained charitable interests from people that are seeking to meet the social needs. And this calls for researchers to optimize research procedures so that people that are quite vulnerable do not get trapped in the whole research idea in a way to seek solutions to existing problems. Many participants, of course, would engage in research for just altruistic reasons. They want to help solve problems. So out of genuine reasons, they would still go ahead to participate. We've had monetary incentives coming in as a way to motivate people to engage in research. Although some, with or without money, they would still participate in research anyway. But we have begun to see a trend of people wanting to participate in research just because of the money, particularly in contexts where we have so much socioeconomic deprivation, low middle income countries and very deprived communities where money is a quick motivator. In that case, we see financial incentives as inducements. The fear is that soon most potential participants might want to be paid. They want to be paid to meet their need, financial need. But in some contexts, we see that people are beginning to understand what these financial incentives would mean for us in the future. We have schools of thought that are beginning to question, and we all begin to question, why couldn't there be another way? Or is there another way besides the financial incentives? And so differentiated strategies could be designed and tailored to enhance retention. So in research, you're either recruiting or you're finding measures to retain, or you're finding a way to institute a behavioral change. At the moment, we understand that inducement might end us up in research as a commercial venture, rather than seeking answers to existing problems. So we have individuals who are motivated by a sense of a civic duty to participate in research, but others will still keep to their charitable interests with or without any incentives to engage in research. IRBs or research ethics committees make very clear specifications around the fact that researchers must provide some incentives to pay for their time, to pay for their commitment. But all these have implications on the study findings, because what we do know, what we see in the literature is that we have participants who are beginning to enroll in research even though they are not eligible. Just because of the money, they still want to engage, and that influences the results anyway. Next slide, please. So how does this get us into breastfeeding research? And now when I'm talking about breastfeeding, I'm not just looking at the mom and the infant. We're also looking at breastfeeding in the context of surrogacy. We're looking at breastfeeding in cases where the mother is no more for one reason or the other. In that case, breast milk feeding is also another option. And so we need to look at the whole dynamics around breastfeeding. It's not just the biological mother and the infant, but also about the care provider who is doing the breast milk feeding of the milk. It could be from another source. It could be from a milk bank. It could be from a place where it's been approved. So if we're looking for, very mindful of the ethics surrounding this whole. We are having an understanding that breastfeeding is a parental duty. So then the question is, why do we have to pay somebody to engage in a breastfeeding research? Or why do we have to infuse financial incentives into the area of breastfeeding research? So what we do know is that the positive effect of breastfeeding is quite obvious, and there's direct benefit of breastfeeding to the mother and the child. But breastfeeding prevalence, as we know, is very low in many communities. There's evidence around high incidence of starting breastfeeding or initiating breastfeeding, but there are struggles around sustaining breastfeeding. So if you have because of the health support we get at the facilities, most mothers would initiate. But beyond that, how long do they sustain breastfeeding? So we're getting financial incentives into breastfeeding research. We need to look at all these dynamics. Financial incentives has been known to increase breastfeeding prevalence according to studies that have been conducted over the past, that these financial incentives can actually increase breastfeeding prevalence up until 8 weeks. And we know that monetary incentive for breastfeeding, as we speak, is considered unacceptable, but it depends on the context. So then there's an argument for investment rather into alternative or structural interventions to support breastfeeding. But there's substantive evidence for preference across diversities, across different contexts, across individual preferences. And these mediate preferences for incentive schemes. Some families might not want any financial incentives. All they need is a support within the context of research. Others will still want the financial incentive, but the question is why? As Nicolina has given us the background, all these come to bring us into a new space, a new ethical dialogue space, where we question for how long we can continue to sustain financial or monetary motivation to promote breastfeeding or to establish positive behavior around breastfeeding. Next slide, please. So we're looking into the future of incentives in health and breastfeeding research. How will the future look like? There have been questions around financial incentives exacerbating inequalities. There have also been questions around exploitation of families that are breastfeeding, questions around destabilizing local economies because of the infusion of financial incentives into breastfeeding research. That might give us a false representation of what the reality is around breastfeeding, especially in context where there's so much socioeconomic deprivation. I'll leave the space open now, and I know that my colleagues are going to add on to the information. And so at this point, Nicolina, I will pause. And then as we engage in the ethical dialogue, we can look further into how financial incentives and its infusion to breastfeeding research might influence breastfeeding and the whole research venture in the future as we speak. Thank you, over.
Thanks so much, Mary, for these really interesting thoughts on financial incentives, and also pointing our attention to preferences of research participants and potential systemic effects in the ecosystems in which research takes place. I see that we are already accumulated questions in our Q&A function of the Zoom. Please, by all means, make use of this function. We will be collecting these questions and we will come back to them in our discussion a little later once we've heard the inputs from our 4 speakers. So thanks again, Mary, and I'm moving on to the next.
Thank you, Nicolina.
Thank you. Look, I'm moving on to the next speaker, that's Farah Asif. Dr. Farah Asif is a clinical research administrator, head of the clinical Research Office and Secretary of the Scientific Review Committee and the Institutional Review Board at the Shaukat Khanum Memorial Cancer Center and Research Center in Pakistan. Farah Asif and her team have developed research guidelines which define the scientific standards and the code of ethical conduct of research involving human subjects, which should be followed by all researchers of the hospital. And since November 2020, Farah Asif has led the initiative entitled Developing a Policy Statement and Recommendations for Pakistan's Ethics Review Framework and IRBs in support of public health emergency preparedness and response. And she's currently preparing its report. Farah, I'll hand over to you now, and we're looking forward to your presentation.
Thank you, Nicola, and thank you everyone for joining us today. And this is a great opportunity. So in my first 2 slides, I'm basically covering outline of my presentation. So basically, we'll discuss that should we give financial incentives or should we not give financial incentives? What are the ethical issues in giving financial incentives to participants in health and breastfeeding research. And we'll have a look at the empirical research, and we'll have a look what the research tells us. And there are certain questions which are still unanswered, so we'll have a look at that. So can we move to the next slide, please? Yeah. So we will need to assess, we will discuss how to assess that what is the appropriate level of financial incentives and who is responsible for setting this, for making these decisions. So this is what I would be covering in my presentation today. So can we move to the next slide, please? Thank you. Offering financial incentive is a common practice in health research to recruit participants and to retain them. It is generally believed that compensation or financial incentives, it increases the rate of recruitment. It should not be assumed that people must be compensated in order to participate in research studies. While ethical implications of offering financial incentives to participants are discussed in the earlier presentation as well as in the literature in detail, some believe that it is not right to invite participants in research without a compensation offer, as research participation involves a substantial time and effort. At times it involves inconvenience, discomfort, and at times it may involve risk, physical risk as well as psychological risk. So some argue that we should not invite participants for participation in research if we are not offering them any incentives. Secondly, it is thought that paying money to research subjects is one way to provide them with a fair share of benefits. However, it is debatable, should we consider financial incentive as a benefit to participants? Thirdly, some believe that offering financial incentive is one way to express a thank you. So these are few thought process behind the notion who support giving financial incentives. However, the question is, should we give financial incentives, and if financial incentives are to be given to research participants, how we should set the limits and extent of these financial incentives? It remains controversial because of the ethical issues which are associated with the financial incentives. And this has been discussed in the literature already. And some of these has been already covered in the previous presentation by Mary. So we need to ask ourselves that, do people participate in research for financial incentives? Or we can ask this question a bit differently. Let's examine why people participate in research. So can we move to the next slide, please? Right. So there are a couple of reasons for people for choosing to participate in research. They might be attracted to research and motivated to participate for curiosity, for human reason, for the sake of generation of scientific knowledge, for the sake of thrill. They may feel that they may get an added attention by their physicians. Some of the participants hope for personal therapeutic benefit. And yes, there would be few who would be motivated to get money. So this is just an overview of how, what are the different motives of research participants. So with this, can we move to the next slide, please? So it is generally believed that financial incentive boosts recruitment. Let's have a look at what research says. So studies have systematically investigated volunteer motivation have found financial rewards to be an important motivator among normal healthy volunteers in the decision to participate in clinical trials. Also evident is that difference based on the demographic characteristics exist in the motivation and rates of volunteerism. Studies indicate that the offer of financial compensation is one of the main reasons why subjects participate in research. However, subjects often participate in research for non-financial reasons, such as to gain access to medical treatment or to contribute to advancement of scientific knowledge or for public health. Empirical research indicates that research subjects are not unduly influenced by modest financial incentives for participation. There are studies on healthy volunteers which have shown that while monetary incentives influence decision to participate in research, it does not adversely impact judgment of risk. So can we move to the next slide, please? Healthy volunteers who participate in phase 1 clinical trials in which participants receive no medical benefits, financial incentives play a major role, while only a small role in encouraging patients to enroll in phase 2 or 3 or clinical trials in which participants receive treatment for their diseases as well. It should be remembered that empirical evidence demonstrates that payment is necessary and or effective for the recruitment of clinical research subjects is limited. Can we move to the next slide, please? So there are ethical issues which are associated with financial incentives, as this has been covered by the previous presentation. So I would just quickly go through these. Of course, one of the ethical issues which is well established is undue inducement. Offering subjects money for their participation could undermine their independent decision making by encouraging them to make financially motivated decisions against their better judgment. Especially offer of money, if it is sufficiently large, or if a person is in need of money, then offer of money can compromise patient's judgment. Money may induce prospective subjects to take excessive risk at times. However, counter argument is that undue inducement can occur in research without the offer of money. Attraction to get treatment being tested in a clinical trial, it can serve as an inducement. Secondly, a well-established threat associated with financial incentive is exploitation. Ethical concern related to paying human subjects for their participation in research is that offering subjects too little might lead to exploitation, and exploitation involves taking unfair advantage of an individual or a group in a transaction or a relationship. The role of financial incentives in study recruitment depend on the nature of research and the socioeconomic context in which the research is being taken place. A third very well established ethical concern associated with financial incentive is that we may end up in biased enrollment, because it is expected that participation, if participation is associated with large amount of financial incentives, those who are in need of money or those who are expectedly from low socioeconomic strata, they might be more keen to participate. Similarly, we can assume that a study, if it is not offering any financial incentives, it can still be biased in terms of recruitment. It might not attain a fair recruitment, as the participants who do not need money, they might be more keen to participate in such studies. A unique challenge is unequal payments for equal participation in similar studies, and it happens, especially this concern and the amount of payments which are offered as financial incentive in different parts of the world for same research or similar research. These are associated with marked differences in terms of the financial incentives which are being offered. So in low middle income country or in low income countries, only real or potential out-of-pocket cost for participant attendance to a clinical trial visit is considered for assigning compensation. Reimbursement for likely public transport or cost of one meal, and that is it. It is common to offer an amount which is equal to $5 or $10 or even lower. However, if a similar research or a same research is conducted in high income countries or in rich nations, the amount of financial incentives, it is observed that it is quite generous. It may range from hundreds to $1,000. So this difference itself is a threat to equity. And lastly, ethical issues related to vulnerable population. This is very important. The vulnerable population who might not be in the best position to make best decisions for themselves, they are at a threat. And this includes children, this includes breastfeeding mother, and of course their babies. So whenever our research involves any of the vulnerable population, so these ethical issues, of course, they require additional attention in making decisions. So can we move to the next slide, please? So now, how do we identify responsibilities in setting the extent or the level of financial incentives which could be permissible without eliciting any ethical issues? It is the researcher responsibility to plan out and justify to the Research Ethics Board what amount of money should be offered as financial incentives. Then Research Ethics Board should perform thorough assessment of risk at the first instance. When offered, incentives should be appropriate in time and amount. Incentives should not be so large or attractive to encourage disregard of the risk associated with participation. Researchers and Research Ethics Board should be sensitive to issues such as economic circumstances of those in the pool of prospective participation, the age and capacity of the participants, the customs and practices of the community. When determining an appropriate level of payment, investigators and oversight committees should consider the amount of time participation spent in research activities, the risk, the pain, discomfort, or inconvenience associated with the research procedures, or the travel costs. Can we move to the next slide? Investigators and oversight committees should work together to establish appropriate financial incentive for research participants. Institutional review boards should not consider payment a benefit to offset research risk when deciding whether or not to approve a study. IRBs evaluate whether the risk in a research study are justified by potential benefits. Otherwise, unacceptable risk cannot be made acceptable by offering money to the participants. And with this, I would end my presentation, and I'm looking forward to the discussion as well as presentation from other colleagues. Thank you.
Thanks so much, Farah. And I think it's been fascinating to see some convergence regarding, your reflections on appropriateness of incentives. That, for instance, risk cannot be compensated by paying, higher amounts that actually coincide with what our Swiss colleagues have been thinking. I'm now curious to move on to Dr. David Yanni Gisavadrot. He is a professor at our economics department at the University of Zurich and has joined the university in 2016 as professor of development and emerging markets. He's also an affiliated professor at the UBS Center for Economics and Society and managing director of the Larsen Rosenquist Foundation Center for Economics of Breastfeeding. Before joining the University of Zurich, he was an associate professor of public policy at Harvard University, the John F. Kennedy School of Government. He did his PhD in economics at IAES, Stockholm University, and his research interests include political economics and economic development, with a current focus on health, culture, conflict, and globalization. David, I'll hand over to you now.
Thanks so much, Nicola. Thanks everyone for tuning in. I'm excited to be a part of this webinar. So I'm an economist. I'm going to try to share, I think, perspective of what I think is sort of a typical economist. I've done some research myself in developing countries, including on health. And let me just start by saying that I think, I fully agree with sort of the basic points that Farah laid out before, sort of some basic, ethical issues that may exist in theory. I want to add a little bit to this in terms of thinking through the theory. I'll talk a little bit also about sort of in practice, what I view the problems may be. And I suspect that maybe later on, David Resnick will maybe talk a little bit more about the empirical evidence on, or if not, maybe we can come back to that later. But let me just rephrase the question, perhaps, the way I think about it as an economist. It's basically, when we talk about financial incentives, I think we can frame it as sort of just about right, or too little, or too much, right? So you can pay too much, you can pay too little, or just about right. And of course, we want to get to a situation where we pay just about right from a ethical perspective. And that might include zero, right? So that might include like none, right? And so the way I think economists tend to address these problems, first think it through sort of in theory. And again, I think like Farah, for example, has laid out some basic theoretical problems. But also then, of course, empirically, sort of how, sort of what's the evidence for these. So, you know, let me start with a generic basic economics principle, which is that people are better off with some cash rather than without it, right? So if you give sort of $20 to a person compared to not giving $12 per person, that person is better off sort of under most normal circumstances, right? So I think that's sort of at least a basic principle that economists in general adhere to, right? But economists are not naive as well. And so there could be situations where money actually is a bad thing. And I think those are the kinds of situations we're discussing here, right? But I do think that sort of baseline is sort of important to keep in mind. So that is, in general, people are better off with, you know, with getting paid for something, right? Now, I also want to sort of put some basic principles on the table here, which is I think we can all agree, or economics has shown over and over again, that financial incentives affect behavior in very many different contexts, including if the price of a good is high, people tend to demand it less, right? And including wages, if wages are high, people tend to want to have that job more, right? And so you can apply that to financial incentives for research as well. But there are sort of two distinctions here that I think important to keep in mind. So financial incentives where you want to create behavioral change for recruitment and retainment, right? So that's drawing people into the research, but the incentives themselves are not supposed to affect the behavior being studied, right? So that's one type of, I think, role for financial incentives that have been discussed. But then there's another role, which is that the financial incentives themselves are of interest to the researchers, right? What are the effects of incentives on health behavior, for example? And so let me give you sort of a couple of examples that I think would fit these two bills. So first, you know, suppose a very simple study, you just want to run a survey with someone, you know, a 20-minute survey on, say, nutrition and health behavior in the past year, right? So this is probably a very low risk type of research where like the researcher doesn't see a big risk, and by all plausible sort of reasonable sort of assumptions, the risks are very low from participation, right? In this case, we can still discuss too much or too little, but the likelihood that you pay too much seems very low, right? Because the person is better off. So if he or she gets $20 versus $100, they're probably better off with $100. But of course, there are other situations where the risks or uncertainty might be much, much higher, right? So for example, recruitment for a new experimental drug, right? The researcher might have some prior about like the uncertainty and risk involved, but they're not totally sure, right? So here, I think this is a situation where, of course, you can pay too much, potentially, along the lines laid out before. Undue influence, for example. Right? Now, the second type of financial incentives where you study behavioral change itself, that's sort of an interesting, you know, there's a whole set of research on that. So let me give you one example. A recent study in Science, the journal Science, last year, studied the financial incentives for getting vaccinated against COVID vaccines, right? So, you know, we have financial incentives, you know, as a public policy. Basically, we have heavily subsidized in most countries COVID vaccines. But this study wanted to sort of understand like what are the impacts of sort of financial incentives. So they even paid people $20 to get vaccinated and to test is there a big impact or not. And there was a huge pretty big impact in Sweden that they studied, right? So because we know pretty much that from other randomized controlled trials that these vaccines are safe and highly effective, this intervention, the incentives themselves probably save some lives, right? So you could say, well, did they pay too much, too little, or just about right? it's not clear, right? You could make an argument that they actually paid too little, because if they paid more, they would have had even more people getting vaccinated for COVID vaccines, and even more lives would have been saved. So, but it's not obvious. You can take a paternalistic view and say, look, these people took the vaccine just to get the money, but they're actually worse off from it, right? So then you would have paid too much. It's not exactly clear empirically which situation we're in. Right. So let me just, so those I think are some key distinctions that I want to highlight. Let me say that I think, I want to make one more point from a theoretical perspective, which is the way I think about this, and I think a lot of economists think about these kinds of problems, through a principal agent problem, where basically, and this is a well-known economics framework for various social contexts, which is basically the principle here is the researcher and the agent is the participant. And the sort of the potential problem here is that there's asymmetric information, which is that the researcher might have a much better information about the potential risks involved, or the uncertainties involved, but the participant may not. Of course, the participant is not an expert on whatever we're studying here, right? And then the question becomes, well, if you introduce high incentives, does that change sort of the welfare for the participant, right? So first of all, if you might increase participation, that's kind of obvious, but the high incentive itself might actually reduce the likelihood that the participant pays attention to the risks described by the researcher, right? Because they want the money, right? This is called undue inducement. So this exists even if you provide full information to the participant. But there's another scenario which is, I think, just as problematic, at least in theory, which is that there's a strong incentive on behalf of the principal, the researcher, to conduct the research and get published, right? And so they may downplay the risks because they don't quite fully know the risks, uncertainty, and they have an incentive to kind of downplay them, right? And in that scenario, of course, we're in big troubles, right? Because now the information is not even being provided to the participants, right? And on top of that, the research could just be evil, right? Like basically coerce people, exploit people, etc. Okay, so those I think are some basic theoretical sort of, principles that we can apply here. So then, I think we have to ask the question sort of, well, what does this all mean in practice? So I think the first thing that's sort of obviously comes to play is that someone needs to monitor the researchers, right? And so do we have such a process in place to make sure that the researcher doesn't engage in bad behavior? And here I think the system is set up pretty well, in the sense that we have IRBs, we have ethical commissions or committees that go through some of these things, right? So overall, my sense is that this has worked quite well. Like, obviously people can make mistakes. It's not easy in any given circumstance to kind of figure out how big of a problem it is. But at least the process seems approximately right to me, at least in most circumstances. So those are some thoughts that I have. Thank you.
Thanks so much, David, for your input, and also for pointing to the potential role of incentives as a confounder, and for raising the question of how much maybe too much or how much maybe too little, as it was phrased. And I've seen this, when scrolling through our Q&A questions, this was one of the questions earlier on that you already embarked on. So thanks a lot for your input again. And for all of those of you who are listening, please feel free to keep those questions coming. We'll address them in a moment. But before we get to a general discussion section, it's now my pleasure to introduce Dr. David Resnick, bioethicist at the US National Institutes of Health. Dr. Resnick holds an MA and a PhD in philosophy from the University of North Carolina at Chapel Hill, and a JD from Concord University School of Law. Dr. Resnick was an associate and full professor of medical humanities at the Brody School of Medicine at East Carolina University, and an associate director of the Bioethics Center at the same institution. He was also assistant and associate professor of philosophy and director of the Center for the Advancement of Ethics at the University of Wyoming. He's published over 250 articles and 9 books on various topics in philosophy and bioethics, and he's a fellow of the American Association for the Advancement of Science. He serves on several editorial boards and is associate editor of the journal Accountability in Research. And Dr. Resnick was chair of the NIEHS Institutional Review Board and is a certified IOB professional. We're very much looking forward, David, to your input now.
Thank you. All right, next slide, please. Okay, we're on this slide. So I'm not going to say a whole lot because I think most of it has been covered. You can see this is a slide why financial incentives are offered to participants. Next slide, please. So why is it regarded as unethical? People have already, why is it an ethical issue? People have already covered this because it may undermine your free choice, which is essential to informed consent, and it may encourage exploitation of low-income participants or children. Next slide, please. So just to talk about consent just briefly, it's a key part of the ethics of research is that consent must be ethically and legally valid, and for this to happen, it must take place under conditions that influence the possibility of coercion or undue influence. Now, review boards sometimes talk about money as being coercive, and maybe the public does too, but I think this is a conceptual mistake because coercion really involves the threat of harm. And money, if it's anything, it's not really harming people, it is potentially a benefit. Next slide, please. So really what people have come to understand then is that offering money may be undue inducement. It may interfere with a person's judgment and reasoning. They may be too eager to enroll in a study or remain in the study when things are going bad. They may overestimate their personal benefits and underestimate their personal risks when they decide to enroll. However, the literature that is emerging on this does not support really that idea that money is usually an undue inducement like this. Next slide, please. So there have been a bunch of studies, and I won't go through them all here. I think there are some more than I put up on the board, and I think some of these have also been cited by others. But basically what these studies show is that money does influence the willingness to participate in research, which is something we would expect. But it doesn't really influence persons' judgments of risk. In fact, there have been some studies that showed that when people were offered more money, they thought the research had to be riskier. So anyway, it doesn't seem to be necessarily an undue inducement. At least the empirical research is pointing in that direction. Next slide, please. Now, there are some studies that show that offering people money may encourage people to lie. So this is not really, it's a different kind of undue inducement. It's involving their decision. So they're basically lying so that they can qualify for the study. And this is much more of a concern with healthy volunteer research, where the reasons for being in the study really are more financial than anything else. Interestingly, so this study, it's not really the amount of money that influenced people's willingness to lie, but the fact that they were offered any money at all. So what the study may show is that some people are willing to lie in order to earn money, but not necessarily the amount of money matters that much to them. Next slide, please. So there are some limitations on these studies. And I think an important one that we don't really understand very well is the effect of money on low-income groups. So these studies did not control well for income, race, ethnicity, education, and other demographic variables that might affect the willingness to participate risk perception, the willingness to lie, and things like that. So I think we do need a better understanding of how money affects low-income groups versus high-income groups and vulnerable populations. It might be the case that money has more of an effect on low-income groups than high-income groups, and I think that would stand to reason. That would be my a priori hypothesis, but we haven't done the empirical research to look into that. Next slide, please. So another issue I think is important, and we've talked about it a little bit, is exploitation. So this is when you're not paying people enough money. You're really, they're underpaid in research. And this may be true in certain kinds of studies where they're taking a fair amount of risk and they're really not getting much of a benefit. The benefit is accruing more to the, say, the sponsoring company or the researchers than the person in the study. And so underpaying, not paying people enough can be an issue as well. Next slide, please. So exploitation is another way that this can happen is where you have not exploitation of individuals, but of groups, so that you get certain low-income groups disproportionately disproportionately participating in studies, which can lead to bias, as was mentioned earlier. And so they can be exploited as a group. And also there is a possibility sometimes that parents might exploit their children in order to be in studies. Now, this is really a very difficult problem to address because it has to do with social and economic factors that are outside of the research context, such as poverty and socioeconomic disparities. It's a really hard thing to get a really good balanced enrollment. I think one thing that is not a good option is to offer high-income participants more money to participate to try to balance out your enrollment. I think this would be totally unfair. You know, you should have equal pay for equal work. So really expanding recruitment efforts to different groups, demographic groups, may be the better way to go than stratifying the payment. Next slide, please. Okay, so these are just my references, and I can make my slides are available to people if they want to look at them after this presentation. So that's all I've got. Thanks.
Thanks so much, Dr. Resnick, for your presentation and for presenting some of the empirical literature to us, and also for pointing to the important gaps in the literature regarding potential differential effects on different socioeconomic strata. I'm sure we'll come back to these issues in the discussion, and it's now a pleasure to hand over to Tanya for the next part of the webinar.
Excellent. Thank you. So now we will have a Q&A section with our audience and our speakers. Please do remember, if you've got more questions for our panel, please do type them into the Q&A so that we can pick up on those. Just very briefly, before I start reading your questions aloud, I would like to ask our panel if you have any burning questions or if you would like to say something about any of the presentations. If anyone would like to jump in. So otherwise, I will just start with the first question of our audience. So Alok asks, are we going to have ethical frameworks for different domains of health research? I was wondering, Professor Resnick, what would you say about this?
Can you repeat the question, please?
Yes, are we going to have ethical frameworks for different domains of health research?
I'm not exactly sure what the question is. I think really the way things work is that we have some general ethical principles that apply to all research, and IRBs take the information for the study when they're looking at the research. They take all that information and they make a very fact-based decision that takes into account the context of the research. So the ethics may differ a little bit because of the facts that you take into account, but I don't think that we would have fundamentally different ethical principles for different kinds of research. I think it would be basically the same. That's what you see really with, I don't know, maybe Farah, you're an IRB chair, aren't you? Farah Asif, do you have some thoughts on that?
Thank you for the thoughts. So I would guess that one of the trigger for this question could be because we just started with the introduction of the framework for ethical framework for breastfeeding research. So maybe that is one stimulus for this question. Maybe this is my guess. So, and I would agree with Professor Resnick that it might not be possible, or it might be a good idea to have separate frameworks for every research, because the principles might not vary. The basic principles would be the same that we need to uphold. So, but yes, certain research areas, and especially when it comes to vulnerable populations or the populations which have distinct features which make them more vulnerable, or where it is hard for them to make decisions, or the likelihood of the risks is very high, as you can see. For breastfeeding research, the risk is for the mother as well as for the babies, for the infants. So such special populations or scenarios may call for special attention or dedicated frameworks. But I would agree with Professor Renstick that we might not need it for every single disease. Thank you.
Maybe just briefly comment on this. And I think you're quite right, Farah, that the intention of and I think this question is really addresses the ethical framework for breastfeeding research. And you know, it was really pulled together for convenience, not to say there is a separate there's separate norms specifically for one area of research that do not apply to any other. But if we look at the breadth of our research ethics guidance, we know that certain areas are more elaborated than others, depending on researchers and reviewers' needs, right? So what we had wanted to pull together for the convenience of researchers, of reviewers, of sponsors, is really those concerns, those areas and norms that apply to this quite heterogeneous field of breastfeeding research, actually, where you have breastfeeding mothers, you have newborns, etc., and to make sure we have a sufficient level of detail for those areas that might not matter for more general research ethics frameworks. But of course, there's no separate, let's say, breastfeeding research ethics or whatever, but it's really more a matter of where do you provide more detail and how do you pull content together.
Great, thank you, Nicola. Now I would like to ask a different question. Perhaps this one is for David Yanagisawa-Trott. So it's a question from FIRES. The question is, financial incentives can be used to promote health-related behaviors among less privileged groups, but what would be the long-term social value of such research for the study participants? How participants will be able to maintain healthy behaviors when the study ends and without financial support? What is your view on this as an economist, David?
Thank you. I guess there are two questions that are separate here, right? So the first question is, right, financial incentives can be used to promote health-related behaviors among less privileged groups, but what will be the long-term social value of such research for the study participants? So, you know, let me say, I think the social value of research typically is not defined as the social value to the participants themselves, but that the research will provide new knowledge that could influence how we conduct policy in the future. So it has potential, you know, great social value, right? It could, for example, be ways by which we figure out how to help people make better financial decisions, or, you know, nutritional decisions, that kind of stuff, right? And so, you know, that's like, I think, a basic principle that we should all strive for, that this is, you know, this is research that's worthwhile conducting, right? And so the financial, so here we're talking about financial incentives, right? So I think, again, we want to break down two different types of purposes, right? One is for recruitment and retainment, right? So if the financial incentives influence whether people want to participate, right? And it doesn't have these potential downsides that we have discussed, right? But you wouldn't be able to do this research in the absence of such financial incentives. Well, then potentially having no financial incentives is a bad thing, right? Because the research won't be able to create this potential knowledge, right? But then there's another type of financial incentives you could have, which is, can you use financial incentives to induce quote unquote better healthy behaviors, right? This is a much trickier, let's call it ethical or normative space to operate in, because you sort of have to take a stance on whether people are rational basically or not, roughly speaking, right? So do people understand what's in their own best interest, right? And so, and then in particular, perhaps vulnerable, what we call vulnerable populations, right? So if you think the answer is roughly yes, and I think the overwhelming empirical evidence points towards that, that is, even poor people make decisions that are in their own best interest, right? Then sort of the potential problems of providing financial incentives to induce better healthy behavior could be, you know, justifiable. Now, what is better healthy behavior is, of course, something that research is trying to figure out as well, right? So in a range of contexts, like what is good nutrition, for example, exactly, right? Like this is an evolving field, you know, so there are, you know, question marks also there, I think. But I guess overall, I'm less sort of, you know, I can see certain edge cases where like you want to be super careful, but you know, I think for the vast majority of the type of research context that we're studying, you know, I think the problems are sort of relatively minor, and this is partly based on the evidence that sort of David Resnick brought up before. So yeah, so I think that just answering that first question is enough, perhaps.
Yeah, thank you so much. I was wondering whether, Mary, if you would like to say something about this, considering your experience regarding breastfeeding research.
Okay, so as David rightly explained, it can be a little bit tricky when it comes to promoting healthy behavior around breastfeeding and getting families to breastfeed. And like I did say earlier on, the quite some dynamics around the breastfeeding, because you're looking at not just the mother and the child, you're also looking at the gender questions around breastfeeding. We are having evolving conversations around gender and how that impacts current breastfeeding practices. So, and especially also within the surrogacy context, how do you even get that data? Within the context of different families, how do you even get the data? So if we're trying to promote breastfeeding, or we're trying to change the behavior around breastfeeding, we're looking at research and how we can recruit participants in that. It can be a little bit tricky. How do we do it? Well, how much money will be sufficient? Or perhaps we just wouldn't need to give any money at all. We need to look at the concept, because one thing we also need to keep in mind is that breastfeeding is a cultural norm, is a social expectation in some context. And so whether you give money or not, it's something they're already doing. But within the literature, we do know that it's not so much of a problem to initiate, but a problem to sustain the breastfeeding over the period of time recommended by global standards. And so I do agree with David, it can be a little bit tricky, but where inducement comes in, then it becomes problematic. Then it raises ethical questions around, disparities around different income classes and how much money is enough and whether to give or not to give. It's hard to take a stand, but these open up ethical spaces where we begin to dialogue around, should we give or should we not give? Like Farah rightly explained, in contexts where there's so much socioeconomic deprivation, one is very careful about using money as a bait, or using money as a measure to recruit and to retain, and more so to change particular behavior around breastfeeding. How about if we begin to dialogue around different alternatives? How about if we begin to look at alternative choices around how to promote those positive behaviors rather than the financial incentives? That's my take on it. Thank you.
Thank you very much, Mary. Does anyone else would like to say something about this topic?
Just quick follow-up. I think Mary made some very good points there towards the end about non-financial incentives. And this is something that social scientists, economists have studied, or it's become quite a hot topic. So for one thing, there seems to be growing evidence that monetary incentives crowd out intrinsic incentives. And then so, you should, there are sort of risks, or let's call it downsides with introducing money in a situation where the situation potentially could be solved without introducing money, because people are intrinsically motivated for various pro-social behaviors. Then on top of that, people are driven not just by intrinsic motivations, but also social incentives, right? Social acceptability, there are certain social norms, and basically social image concerns, right? You want to be socially accepted in a group. And this is also a very strong force. And there's a growing literature now studying how these, from a policymaking perspective, can be leveraged to induce healthy behavior. So for example, there's a pretty famous paper from South Africa that tried to increase condom use to combat HIV/AIDS, right? They did a randomized control trial to look at what, financial incentives versus non-financial incentives, and among barbershops actually that had an incentive to distribute condoms. And they found that the most effective thing was actually just to provide gold stars to the barbershop that was able to distribute the most amount of condoms. And the financial incentives were much, much less effective, right? So the idea here was that these barbershops could just signal, look, we are pro-social, we distribute condoms here, and we were very, very, very good at doing this. And they get rewards, social rewards and appreciation in the community for this, right? So, and the money actually just crowds out this, right? Because then people think differently about the people distributing condoms. They're doing it just to get the money, and then basically can backfire. So yeah, so I think you're raising a very good point, Mary, that's worth thinking about.
Thank you, David. Nicola.
Tanya, may I interject a quick question here, because just looking through the Q&A, I think that's a pervasive theme here. And that concerns the risk of exploitation, either by paying too little or by paying too much, or by paying it all. And, when we composed the panel, we were thinking it would be great to have someone who's a representative of the lobby group of people who are actually participating in studies. And we found it very hard to, we actually didn't manage to find any kind of groups that stand in for the interests of those who participate in research, maybe with some frequency. And so I was just curious if any of you in this panel, or also our participants, had ever heard of such a group of actually representatives of people, people who would represent the interests of this group of research participants. So we could actually also hear from those, and rather than just discussing exploitation from, let's say, the end of those who are planning research or reviewing research, and actually involving research participants, maybe not only then kind of a random participant, but someone who actually really stands in for the interests of this group.
I don't know of any particular organizations, but we, on our IRB, we have certainly had research participants as IRB members, people that have been participating in research, and they express their interest to the group, to the board making the decision. I would like to just mention a second. We have definitely had underpayment as an issue on our IRB. We were doing a study where we were trying to enroll girls that were overweight for a study of obesity and hormones. And they were having trouble getting overweight teenage girls in the study because they weren't paying enough money to the mothers, because basically for this girl to be in the study, the mother has to take off work, has to drive her daughter over, and so we weren't paying enough money, and that's why we had this enrollment issue, and it was a bias issue too.
Yeah.
I tend to think that IRBs worry more about paying too much money than not paying enough, and there are definitely issues when we're not paying people enough money. Yeah, and let me just add in here too. Clinical research is a big issue for getting enough money. People, when at the NIH, when people do cancer studies, they may have to be in the NIH for several weeks getting treatment, and somebody has to be put up in a hotel. Somebody has to stay at a hotel there with them, like their caregiver or whatever, if it's a child, their family. And we're not paying people enough money. We're not giving people enough money to stay in a hotel, to get food, transportation, everything. We're not even talking about money over just to be in the study, but we're not even compensating people fairly for their expenses. And that's an issue we face.
Thank you, Dr. Resnick. We've got 4 or 5 more minutes left in this section, and I've got a question that I'd like to ask before we finish. It's a question by Lovelock. It's related to what we are discussing right now. So the question is, how much is too much, especially when we consider the diverse economic backgrounds of participants? So just to wrap up, perhaps, what kind of advice would you give to colleagues that offer financial incentives to participants in health research? David Yanagisawa, would you like to jump in?
Well, I guess I would say you really have to know the population you're dealing with and the risk of the research and everything like that. Sometimes it seems to me that if you're going to ask somebody to take a pretty big risk in a healthy volunteer study, you should make it worth their while to take this risk for research, not just for humanitarian reasons. Other kinds of studies, like when they're getting a direct clinical benefit, it seems like you don't really need to pay them anything over and above their costs, their personal costs, to be in the study. So it really does depend on the study and what their costs are, what the population is you're dealing with, and things like that. I also think we haven't talked enough about age in here, but I do think that because children can't make clear decisions, that has to be a factor in how much money is offered to them and their parents, things like that.
Thank you, Dr. Resnick. Who would like to jump in now?
Yeah, just quickly, I agree that it's hard to provide a general answer because you have to take a look at what exactly is the research that's being done. But let's say in a very low risk, essentially 0 risk situation, right? Suppose you're just running a survey, right? For, say, trying to measure people's behavior and health outcomes, right? And you just ask them a bunch of questions, maybe it takes 30 minutes, maybe it takes an hour, right? Then I don't think, basically from an ethical perspective, that you can pay too much, right? It's like, that seems like a problem that usually doesn't exist. The researcher isn't going to pay, $10,000 for that 30-minute interview, right? So suppose the market rate would be that I could have gotten the same sample size for $20, but I pay 30. It's like, well, what's the big problem here? Like, the research budget of the researcher is a little bit smaller next time around, but it doesn't seem like there's a huge ethical problem.
Thank you, David. Mary, any thoughts on this?
Yes, so just to add on, David has said quite a lot, together with David Zurich. But what I'll add is that within breastfeeding, we need to look at the different populations within breastfeeding. Usually there's always the assumption is that it's always the mother, the biological mother and the child. But we also need to look at breastfeeding within the context of maternal mortality. In contexts where milk banks exist and we have family care providers stepping in to help the child to survive, we need to look at the populations we are trying to get the information from, or we're asking them to join the research on, and how much is risk for them. What kind of risk are we talking about here? And we look at all the ethical issues we've discussed so far since we began, and what the benefits would be. What would the benefits be to the population? I think these are some of the things we need to begin to talk about, and how we can make research beneficial to the population that we are getting the information from. Thank you, Uwe.
Thank you, Mary. These are a very important point, I believe. Farah, is there anything you would like to add?
Thank you. Just a follow-up of my colleagues' ideas. So basically, it is a tricky question to set limits to what is appropriate or what is an okay incentive to offer. But the takeaway from this webinar is, I think we have discussed really good points, like non-monetary incentives is one point. And secondly, we need to come together. We need to have an ecosystem where the financial incentives can be offered in a way that the research is being monitored. In an ideal world, we believe that there are ethics review board, there are IRBs, there are regulatory bodies, then there is some other oversight mechanisms. The researchers are, they are looking at it, that what is appropriate financial incentive or the compensation or the reimbursement as per the specific research under hand. So all the stakeholders, they play a role in having answer to all these difficult questions, because we just cannot come up with a single figure for different types of research or for a certain area, because we need to keep in mind that for multi-center research studies, when a research is being done in rich countries as well as in low middle income countries or low income countries, so it might be hard to have a quick answer. So we need to have a favorable ecosystem. Yes, and that's pretty much it. Thank you.
Thank you very much, Farah, for raising this important point. So thank you for sending all of these interesting questions, and thanks to our panel for this very lively discussion. Now, let's move on and let's go to the very last part of this webinar, the second round of our poll. So we know that our audience now isn't exactly the same as the one at the beginning, because some new people have joined, others have left. Still, we would like to see what you think after this discussion. So we will ask you the same two questions that we asked before. Again, participation is anonymous, and speakers and hosts will not be allowed to vote. So let's start with a poll now. So question 1, is it permissible to offer financial incentives, for example, payments, vouchers, gifts to participants in health research? You can answer yes, no, or I don't know. And the second question is, in your opinion, what is or are the main ethical concerns regarding the use of financial incentives in health research? Here you can choose multiple options. So you can choose undue inducement. People can be encouraged to make a financially motivated decision against their better judgment. Exploitation, so people may be offered inadequate compensation considering their contribution in terms of time, effort, inconvenience, and opportunity costs. Then we have biased enrollment. People from vulnerable groups may participate in research at a higher rate than people from privileged groups. And fourth, bribery in studies that promote health-related behaviors, for example, having a healthy diet. Financial incentives can induce people to do the right thing for the wrong reason. 75% of the people who voted now think it is permissible to offer financial incentives for participants. 21% of the people who voted think it is not permissible, and 4% of the people say they don't know. According to the people who voted, the main ethical concerns regarding the use of financial incentives in health research are in this order now. First, biased enrollment with 75%. Second, undue inducement with 73%. Third, exploitation. And fourth, bribery. So the results of this poll, the first question is pretty much similar to the first poll, although people who voted in the second round think that the two main ethical concerns regarding the use of financial incentives in health research are, first of all, bias enrollment and then undue inducement, while in the first round, it was the other way around. First, undue inducement and then biased enrollment. So thank you very much for participating. And now I'll hand over to you, Nicola.
Thanks a lot. This was really fascinating to take part in. And, my takeaways are really, conceptual clarity is key. So we really do distinguish between removal of disincentives, reimbursement of expenses, and the provision of financial incentives. I think that's important. And looking at all your questions, many of which were about standards of benchmarks, or this how much is the right amount kind of question. I think although it may be hard to have like a universal standard, a universal benchmark, I think we should try to go some way towards operationalize those ethical principles of non-exploitation. Or avoiding undue inducements. And I think there is work ahead for our field. So I think we've now reached the end of the seminar. It's my pleasure now to, again, thank our speakers, Mary, Farah, David Resnick. Thanks so much for taking the time to be with us today, for your presentations and for the discussions. And thanks also to our audience for your questions, for participating in the polls. And I'd also like to thank the organizers, the Institute of Biomedical Ethics and History of Medicine of the University of Zurich, the Swiss Medical Weekly, the Global Health Network of the University of Oxford, and LactaHub. And to finish, I'd like to invite you all to the next webinar that we are organizing at the Forum for Global Health Ethics, which will be on proportionality and evidence-based pandemic management, and it will take place in June. And we'll announce the date very soon. And please write us your email in the chat box if you'd like us to send you the details of this webinar, or drop us an email at the address that you see on the slide. I'm looking forward to seeing you next time for our next webinar of the Forum for Global Health Ethics. See you soon. Stay safe, stay well. Thank you.